allergy season is in full bloom, and most people know that seasonal allergies can cause inflammation and weaken your immune system. But most don't realize that they severely affect the heart and lungs and can eventually lead to heart disease. So joining us, world-renowned cardiologist Dr. Sinatra with 5 alternative home remedies and approaches to calm down those allergy symptoms and protect your heart. Hey, thank you so much for joining us. Really appreciate your time today.
Oh, it's great to be here. And I have to tell you, I am very privy to allergies as a heart specialist. I mean, I used to live in Connecticut during the allergy season.
Oh, yes.
And as a heart specialist, I developed all sorts of allergy symptoms. But when the allergy symptoms went into the lung and you develop extrinsic asthma, that's when it's really serious. And I tried every remedy known to man. I mean, medications, antihistamines, steroids, antibiotics, you name it. The only thing that really helped me was a lot of alternatives, as well as moving out of the state during allergy season. So I was blessed that I could move to Florida, during April and May.
Not many people realize that there's a link between allergies and heart disease.
Absolutely. See, one thing that allergy does, it sets up an inflammatory response. And we used to think that cholesterol was a cause of heart disease. No, that's not it. In fact, I wrote the great cholesterol myth years ago, debunking that theory. But I'll tell you one thing, allergies will set up inflammation, and inflammation going forward is the root cause of heart disease over time.
Wow. Well, it's very easy for us to grab over-the-counter medication when our allergies are acting up. Is that the best way to go? What do you think?
Well, it can give some people some relief. In other words, it can dry up the mucous membranes. But I'll tell you, in men my age, they can affect the prostate as well. So using these over-the-counter remedies and middle-aged men, can have a downside because of urinary retention. So, people in my age group have to watch it very carefully.
All right. So what are these alternatives that you think are working for you?
Well, first of all, a good diet. I mean, you want to avoid gluten as much as you can. You want to avoid the sugars, because sugar sets up even a more inflammatory response. And certainly dairy. I mean, I've seen a lot of people in my practice during allergy season, I would get them with gluten, dairy, and sugar, and that was enough to take away and what we call an additional allergenic load superimposed on the pollen, and a lot of people improve. And there's certain foods that are great, like onions, for example. Onions contain quercetin, and quercetin is one of these incredible bioflavonoids that really support the immune system. Strawberries are good. Pineapple contains bromelain, and bromelain is a potent anti-inflammatory. So there's lots of things you can do. Foods to avoid, foods to substitute. Apples contain quercetin. That's a great, fruit to take during allergy season. Again, quercetin has an impact on mast cells, and it can relieve the symptoms of mucus drainage, as well as even the inflammatory cough, for that matter.
Wow, so interesting. And what about those neti pots that I see? Have you ever tried those?
Yes, of course. I mean, I've tried everything, believe me. Neti pots can actually free up the nasal passage of a lot of allergens. You can increase the flow of water going through the nasal passage, and it comes out and it cleans it. So you tilt your head to one side, and whenever you can improve the airway and get rid of mucus and sludge and bacteria, that in itself works as well.
Wow. And what about acupuncture? Some people may be wondering if that's an option for them.
Sure it is, because one of the things is when you have an allergic response, you're overtaxing the sympathetic nervous system. So you can use acupuncture points where you can balance the sympathetic nervous system with the parasympathetic, bring down this heightened activity, and people can get relief as well.
And obviously, there is a difference between allergies and COVID-19. Many people on heightened alert, of course, whenever they get any kind of illness, is this COVID? But of course, allergies, typically you don't have a fever. Any other way to really tell them apart?
Yes. In fact, that's a good point that you really made, because if you don't have a fever, it's most likely allergies. If you spike a fever and you have respiratory symptoms, and if you lose your sense of taste or smell, and have an overwhelming headache with a higher fever, that points it more to COVID-19, certainly. I mean, allergies can mimic the symptoms, but the gravity of the symptoms are much worse with COVID.
Where can people go to learn more? Very interesting information you have here.
Oh, people can go to drsinatra.com or heartmdinstitute.com. And again, I was a cardiologist in Manchester, Connecticut, years ago. So there's a lot of people that I've treated in central Connecticut over the years.
Well, these can be so uncomfortable. I know people are willing to try anything. So, Doctor, thank you so much for your time today. Great options available here. Appreciate it.
Thank you as well.
Okay. We'll be right back after this short break.
Looking for